Tonight, we are talking about the AIP diet or the autoimmune protocol and what it has to do with your Hashimoto's disease. What is the AIP? Why should you use it? How do you use it? We've got two awesome speakers with us. We've got Risa Groux and Stephanie Ulrich. Hopefully I got that right, Stephanie. We are going to start with an intro from each of our speakers. And then we're going to go into a panel discussion with some questions we've already prepared for our speakers. And then from there, we're going to open it up to live Q&A. So for those of you that are joining us live, you are welcome to put your questions in the chat box at the bottom of your screen, and we will get to as many of them as we can at the end. Mary Showman is also joining us tonight. Mary is a thyroid patient advocate. She is a New York Times bestselling author. She is also an advisor to Paloma Health, and she's going to help facilitate the conversation tonight. So Mary, I will let you tell us a bit about you and then introduce each of our speakers, and we'll go from there.
Sure. Thank you, Katie. And I'm really happy to be here. We're really excited to talk about the AIP diet, the autoimmune protocol diet. I have adopted or adapted versions of it for myself over the years at various points to try to manage certain symptoms that I've had. And I know a lot of Paloma patients, a lot of my coaching clients, people are really using the AIP diet as a way to manage their symptoms. Because as we all know with hypothyroidism, even if you're doing everything right as far as your medication and treatment, you may still be dealing with unresolved treatment problems, symptoms, difficulty getting to the right levels, and struggling with things that just won't resolve with regular medication. So this is a topic that's near and dear to my heart, and I'm really excited that we're going to be focusing in on it today. So I am going to start by introducing Stephanie Ulrich. And just to give you a little background on Stephanie, she's a nutritional therapy practitioner, an AIP certified coach, and an allergy-friendly recipe developer. So Stephanie's a busy lady. Growing up, she felt like food always played a central part in her life. But after developing an autoimmune disease and extensive food allergies and sensitivities, like so many of us, her relationship with food really was transformed. So as part of her treatment plan, Stephanie started the autoimmune protocol and eventually developed a personalized version that worked for her with her specific needs. So based on her own experience of learning to live well with an autoimmune disease, like so many of us, she felt like she needed to pay it forward, and she became a certified nutritional therapy practitioner, NTP, specializing in supporting clients living with autoimmunity, food allergies, and digestive disorders by creating a balanced and very personalized approach. So we are very excited to have Stephanie with us. And so Stephanie, let me go ahead and turn it over to you to give us a little bit of an overview of your focus and interest in the AIP diet.
Sounds great. So thank you so much, Mary and Katie, for having me, and Paloma Health. I'm so excited to be here and discuss the AIP and how it relates to Hashimoto's. So just a little bit more about me. So like most people who are here today, I also have Hashimoto's. So I was actually diagnosed with Hashimoto's about 10 years ago. And as many people can kind of relate to, I had lots of kind of mysterious symptoms leading up to it with, lots of fatigue. I was, just exhausted all the time. I was having migraines. I was having skin breakouts, lots of digestive disorders, and just brain fog and panic attacks. And I was like, what's going on? And then, eventually I ended up having such a really bad flare where I was actually having terrible vertigo for a few weeks. And because I had such a bad flare, I actually had a great doctor at the time who said, okay, we're going to figure out what's going on. And he actually found out I do have Hashimoto's because he did proper testing and tested for my antibodies. And so that was fantastic. And so, that whole time I always just assumed it was just from chronic stress at work. But, obviously there was some sort of autoimmune issue kind of brewing underneath. So at that point, actually I did discover the AIP diet. And to be honest, I was very overwhelmed by the idea of kind of going through so many restrictions. But I knew at the time that I did have a really severe actually gluten sensitivity. So I knew right away I'm going to be very strict about removing gluten. And I was mostly dairy free for about 5 years. And I was actually doing really well. My antibodies dropped significantly and I was feeling pretty good. But unfortunately, through time, I was still having kind of some more symptoms kind of pop up and kind of, some rashes, and I was having some more digestive issues. And eventually I was diagnosed with yet another autoimmune disease, and then also something called EOE, which stands for eosinophilic esophagitis. And that was very interesting because it kind of led me on the path actually to AIP, because one of the treatment plans for EOE is actually what's called a 6-food elimination diet. So I actually ended up eliminating a lot of the foods that are actually eliminated for AIP. But I was still kind of feeling some symptoms and still some inflammation. So at that point, I was like, you know what? I have another autoimmune diagnosis. I'm going to just go for AIP. And I'm really happy I did, because I just, after a few months and learning kind of how to personalize it for me, because I do have significant actually food allergies and sensitivities that I had to kind of take into consideration with AIP to make it balanced for my own health. Once I kind of figured that out, I started to see a lot of improvement with a lot more energy. My skin started clearing up. My hair started growing back. You could really see the difference. And so at that point, I was seeing so much improvement with AIP, and I decided I'm going to start this website called the Open Cookbook, which is where I share tons of AIP, paleo, and allergy-friendly recipes. And I love kind of experimenting in the kitchen. And I also, started to really become more interested in nutrition and how can we use diet and lifestyle to really better manage autoimmune disease. And so then I became, an NCP, and now I'm an AIP certified coach. And I really love working with the autoimmune community and connecting with people. And so now I do work with clients one-on-one, supporting, others with autoimmune disease and food sensitivities, and, really supporting gut health. And, something I really love making sure is everyone, no matter what your dietary restriction, that you're excited and comfortable and excited, just to cook again and find your food joy. So that's kind of a little bit about me.
Terrific. Well, you're the perfect person to have with us. And we have another perfect person with us today to talk about the AIP diet. And Risa, I'm going to give an introduction to your background for people, but would you please pronounce your last name for me so I don't mangle it?
Yes, it's hard, isn't it? It's Groux, like I grew up. Yes.
Okay, thank you. All right, so we have Risa Groux here, and Risa is a functional nutritionist and a certified autoimmune coach. And Risa's a CN, functional nutritionist, certified immune coach, in private practice in Newport, California. So Risa has always been very passionate about nutrition and good health. She works with issues like diabetes, autoimmune disease, cancer, digestion, thyroid patients, and hormone imbalances, and is supporting a variety of clients, from professional athletes and adults and kids to The Biggest Loser from season 4. Risa firmly believes that the body can heal itself, and whole foods we obtain from the earth, and sees living proof of that in her office every day. She really is looking for the root causes of issues using functional nutrition guidelines, blood and stool tests, and she knows that weight loss is a side effect of wellness. In addition to her private practice, Risa has a line of non-GMO, gluten, dairy, and soy-free products, including the RGN 14-day detox, collagen proteins, chocolate bars, and supplements. We'll have information about where you can reach out and connect with Risa coming out a little bit later. Through years of detoxing personally and in her practice, Risa can validate the benefits of decreasing systemic inflammation and increasing good gut health while removing toxins. So as I said, yet another perfect person to be talking to us today about the AIP diet. So Risa, please tell us a little bit more about your focus and your interest in AIP, and thank you for being with us.
You're welcome. Thank you so much for having me. I love being with my like-minded people, so it's great to be here. I started my nutrition practice basically the same time that I was going through, while I was going through nutrition school. I have a bachelor's degree in business, and I kind of went down that road and became the director of sports marketing for the Ducks hockey team. And just, I read every nutrition book I could possibly read in the meantime. And then I raised my kids, and I had some difficulty with fertility. And so all of a sudden I'm finding out, why is it that I'm not being able to conceive? I had no problems conceiving my first child, but the second one just kept having difficulty conceiving, and then difficulty keeping a baby. So I was saying, what is the story? And I did a lot of research, and I ended up at a fertility specialist who did my blood labs and discovered that I was hypothyroid. And I thought, wow, why do I have this underachieving thyroid, right? What's the problem? And he said, here's a script for that. And I said, oh, so how long do I take this for? And he said, oh, every day. And I said, no. How long do I take this for? He goes, oh, for the rest of your life. And I thought, why am I taking something that is synthetic for my body that my body was actually born to produce? Why is it not producing? Why are we not asking? And nobody in the room is asking why I'm not producing this. So I started on my trail of discovering why I was hypothyroid. And then I went down that rabbit hole quite a bit. And then I went back to school to become a nutritionist. And then I was eventually able to, I discovered I had MTHFR, the common gene mutation that causes infertility and miscarriages. And I went down the checklist of possible autoimmune causes. And at the same time, I was then had a very successful second pregnancy and then was diagnosed shortly thereafter with Hashimoto's. So again, I'm thinking, why is it that I have this? Why is my body attacking itself, right? Why are we in this state of attack? So I wrote a checklist, which I could not find anywhere on the internet or anywhere, of why I would be developing an autoimmune disease. Why is it that I have Hashimoto's? And then I developed that and went through every single thing on the checklist. And sure enough, I had pretty much everything. So I addressed them naturally. And then I was at 1,400 points when I was first diagnosed with Hashimoto's, 1456 to be exact. And now I'm about 10 points away from reversing it completely. So in that process, I became an autoimmune coach because I think autoimmunity, we know the numbers, they are increasing. We have more chemicals, 86,000 to date, as the FDA has approved for us. That's a new number. And we are inundated with toxins. We need to detoxify the body. We need to support the body. We need to eat according to our health status, and we need to quell the inflammation and increase the gut health. So that's what I do. In my office, I have a functional nutrition practice, and I just came out with a book called Food Frame, which is my methodology. And I believe that people should be eating according to their health status. So if you have autoimmune, you're best to be on an AIP protocol.
Terrific. Well, I think we are going to have a lot to talk about today with our two experts. So as Katie had mentioned at the top of the hour, we have some questions that we've put together from the Paloma side to sort of get us started for both Stephanie and Risa. And then we are going to open it up to our viewers. And we're already getting some comments coming in from our viewers who are validating the experiences of both of our experts here. But if you have questions, even as we're going through the other questions, feel free, folks, to put them into the chat box. And we'll be keeping track of those questions so that we can try to get to them. Because once we've gotten through our list of sort of key starter questions, we're going to open it up and try to get to all of your questions. So I am going to go over to Stephanie first with our first question. So Stephanie, can you give us an overview? Because really what we're trying to do here is explain the AIP diet to people who are really not very familiar. And so if you can explain the purpose of the AIP diet in general and how it relates to our autoimmune disease and symptoms.
Yeah, definitely. So AIP stands for Autoimmune Protocol. And so basically it's developed as an elimination and reintroduction diet with a lifestyle protocol with it that's specifically designed actually for people who live with autoimmune disease. So the protocol really focuses on removing what are the most inflammatory and potentially allergenic foods while increasing real whole nutrient-dense foods for autoimmune health. So I think that second part is actually really important because we get really caught up on the elimination side, but it's really also what we add. So what's also interesting about AIP, it's actually based on the paleo diet, which I know people might be a little bit more familiar with, but what it's been basically tweaked and kind of revised to add some sort of additional eliminations of foods that have been shown to be a little bit more problematic potentially for people with autoimmune disease, like Hashimoto's. So you can kind of think of like the approach to AIP almost like a twofold approach. Number one would be let's reduce the stressors on the body through diet and lifestyle. So basically, like I said, you'd be eliminating any sort of inflammatory foods that could be really damaging to the gut, while focusing on kind of lifestyle factors like sleep, stress, and movement. And the second part is, like I mentioned, is really adding in those nutrient-dense foods and a lot of variety, because that's really important for gut health, which I'll talk a little bit about why that's so important for autoimmune disease. So I think a really important thing to consider is, for Hashimoto, sometimes we think, okay, it's my thyroid, but you really need to remember basically it's a disorder of your immune system. So what is something that's kind of in common with all sort of autoimmune disease? It's really leaky gut. And so when you think about also your immune system, your gut, so actually 70 to 75% of your immune system is actually located in your gut. So that's why with autoimmune disease, we really want to focus so much on supporting gut health, which will in turn support your immune health. So basically, really the ultimate goal of AIP is let's support immune regulation by supporting gut health, balanced blood sugar, and regulating our hormones through these kind of changes through diet and lifestyle. So basically, if you think about leaky gut, so I know it's kind of like a buzzword these days, but, just to explain a little bit about what it is, basically leaky gut stands for intestinal permeability. And so if you think about your immune system, your immune system, your gut's really actually separated only by a very thin, like one cell layer, thin mucosal barrier. And you can think of it almost like a woven fabric. And so when you start eating foods that could be inflammatory for your gut or stress, basically it starts kind of having these openings, which allows, unfortunately, for like bacteria and some like larger kind of food particles to escape and starts actually stimulating your immune system. So that might cause things like autoimmune disease and Hashimoto's. So what we want to do with AIP is to really kind of get that barrier kind of tight again. And so you don't have that kind of back and forth between the gut and the immune system. So really, I think one of the main goals of AIP is let's get your gut healed. And then let's really, by doing that, we can start reducing some of those autoimmune symptoms and those food sensitivities that really come with Hashimoto's. And then really adding these micronutrients that come from diverse range of foods to really support your immune health.
Terrific. Well, if there it is in a nutshell, everyone. It gives you a very good overview of what the AIP diet is aiming for, what the goal is. It's to reduce that inflammation, to tighten up that gut lining, and to be able to restore the immune system back to a place of balance. So Steph, let me go to Risa. Risa, can you tell us how the AIP diet works? So we know what the goal is now, but I know that there are several phases to the diet. Is this something we're going to stay on for life? Is it a 2-week diet? Is it a weekends? Is it, intermittent fasting? Give us a little bit of a rundown of some of the mechanics and practicalities of how it works.
Right. So what Stephanie said was amazing, because we do try to help heal the gut and increase the good gut health at the same time that we're trying to decrease that systemic inflammation. So the whole AIP protocol is basically to do that. We're trying to decrease that systemic inflammation and heal the gut. So it is an elimination diet or a protocol. So it's 30 to 90 days is the recommended time period. And I would say if you've been diagnosed a long time ago, let's say you have multiple autoimmune, I'm going to recommend that you go 90 days. I really would recommend 90 days for anybody who can really tolerate it. It is a little bit strict. There's not a lot of variety, but you can absolutely, if you cook, you shouldn't be starving at all. I mean, it has nothing to do with starvation or deprivation, but there's plenty of variety that you can eat and be fine with. But everybody has a different threshold. So the process of this elimination diet is to remove these foods that are causing things, as Stephanie mentioned, to go in through the intestinal lining walls into those tight junctions, and it gets into the bloodstream and it creates antibodies which cause an inflammatory response and food sensitivities, and then eventually we lead to more autoimmune disease. So one of the things that we do is it's a paleo program. However, we do remove some other foods like nuts, which tend to be high allergenic, and those can go through the tight junctions and cause that inflammatory response. Seeds, we remove seeds as well. Eggs, which can be highly allergenic, and nightshades. And nightshades are problematic because they're very high in what's called lectins or phytates. They're really under the umbrella of anti-nutrients. And these are foods that typically cause inflammation. For people with autoimmune, they are really sort of hot buttons. So anybody with rheumatoid arthritis or Hashimoto's or any autoimmune, it really can sort of put little kerosene on the fire. So those are eggplant, tomatoes of all kinds, potatoes of all kinds, except for sweet potato and yams, peppers of all kinds, except for black pepper, and goji berries. Those are typically your most common nightshades, and those are completely removed in the AIP protocol. In addition, there are certain fruits that are permitted and certain fruits that are omitted. So there is a comprehensive list of that. There is no chocolate. There is no coffee. There is no alcohol. So here we talk about this restriction, right? This would be difficult for some people, right? But you can eat animal protein, and you're really focusing on quality. So really good quality animal protein that is pasture raised or wild, that's not pumped with hormones and antibiotics. And then vegetables. You can absolutely eat lots of vegetables. It's unlimited, the amount of vegetables that you can have in the AIP approved vegetables. And then sweet potato and yams, and then some good fats, some avocados and some olives and good fats like that, some really good clean oils. And again, just to reiterate, it's all about decreasing. We're kind of taking a fire hose to that huge fire that we've got in the basement versus a little bit of a water gun, right? We want to quell that inflammation, and that's how we do it with the AIP diet. I have numerous people that I have worked with on AIP, and sometimes the response to AIP is profound. So, but sometimes it's not as noticeable because we're quelling inflammation that we can't really even feel sometimes, but it is very, very effective. And if you can stay with within the restrictions, then you have a really good chance of thriving.
Great, thank you. I am going to go over to Stephanie. Stephanie, Risa gave us sort of a rundown of the elimination phase of the AIP diet and some of the things that we're going to be taking out of the AIP when we're following the AIP. What does the reintroduction phase look like? And what can we eat? We talked about we heard about some of the good things we can eat, but my mind's still focusing on chocolate and coffee and alcohol and the things that I can't have. So tell us a little bit about how long does reintroduction last, and what does that look like, and what kinds of things do we start eating again, and discovering whether or not our body is happy with them.
Yeah, definitely. If you don't mind, because the reintroduction phase is actually a little complicated, I have a little chart that I'm going to share with everyone, just to get people on board. Just 1 second.
Great.
Okay, so basically, like Risa was saying, she explained it wonderfully. So basically, you have like 30 to 90 days elimination, and like she was saying, if you've had autoimmune issues longer, probably the 3 months is probably more appropriate. But once you start feeling like you're noticing significant improvement and you actually feel yourself feeling better, you don't have to be 100%. But you're starting to feel better, then you can start considering the reintroduction phase. And so what's great about AIP is it's actually outlined into 4 different stages. And each stage is really based kind of on what foods are we going to bring back that can give you the most value, like what's going to give you the most nutrient dense option of the things that you have eliminated, and which things are going to probably be the most actually tolerable and can actually be more successful. Again, you don't have to follow this stage precisely. If you have certain like food allergies or other like histamine intolerance or SIBO or other things that you're dealing with, this is just kind of a template. I always like to remind people that AIP is a template and you can really personalize it for you. But for example, so there are 4 different stages. Stage 1, you're going to start looking at bringing back egg yolks, but not the egg whites, because egg whites actually are where the most allergenic aspect of the egg is. And then you're going to start looking at bringing some beans back, like green beans, snow peas, some of the fruit and berry-based spices can start coming back. And of course, the chocolate the coffee, which everyone misses a lot, is actually stage 1. So people get really happy about that. And then ghee, which, is dairy, but it's a little bit more tolerable for people. So if you can do grass-fed ghee, that could be an option for stage 1. Stage 2, then you're starting to look at actually getting in more nuts, and actually even trying the whole egg. Seeds can start coming back, like chia, flax seeds, which can be really fantastic. And then looking at maybe even more dairy and even alcohol in very small quantities. We're all very different in terms of how we tolerate alcohol, but that's something, if you're missing it, something you could consider. And then stage 3, going into more of the nightshades. But like, for example, potatoes, you want to make sure that they're peeled, more dairy, and then legumes such as chickpeas, lentils can start coming back. And then finally, stage 4 is when we're going to start looking at bringing back more of the grains. And as Risa mentioned, like grains and the pseudograins are very high in lectins and phytic acid, which is why they're eliminated earlier. And we want to give enough time for the healing before you start bringing them back to make sure that, you can hopefully tolerate them when they start coming back at the later stage. And then also getting more of those nightshades and legumes. So that's kind of like the 4-stage reintroduction process. And hopefully that helps clarify that process. And then, of course, the ultimate goal is, you want to be able to bring back as much variety as you can. And so after you do that reintroduction phase, you really want to focus on what's called kind of like the maintenance phase. And the maintenance phase is like your personalized version of AIP. What can you eat that's going to work for your body long term? And you want something that's sustainable, balanced, and personal for you. So that could look very differently for each person.
I have a question related to the reintroduction. How long is each one of those? Like, we had those 4 phases. Is it a week? Is it a month? What's the timing on those?
I'd say it's going to really depend on each person, but you want to take it very slow and steady, because you want to basically be challenging your body a little bit, but you want to be able to read your body too. So when you say, okay, stage 1, you're going to be like, okay, I'm going to try the egg yolks. You're going to, try, just like a teaspoon actually at first, very small amount. And then you're going to wait actually, a couple hours. How do you feel? And then you're going to try a little bit more. And then how do you feel? So it's kind of a slow reassessment. And I always recommend that everyone keep like a food and symptom journal, because you want to definitely keep track of what foods you're trying, how you react, like, and, symptoms, whether it's bloating, whether, you even have more like phlegm in your throat, headaches, all these things can actually be signs that you might be reacting to a food. And so it's really important to keep kind of a track, a very clear, detailed log of all of that for yourself. So, and I also like to remind people, like, you might try eggs in the beginning, maybe you don't tolerate them, but that doesn't mean it's forever. It just means maybe you need a little bit more time to heal your gut, and then you can try it later. So I don't like people to get too like upset. Like if, something doesn't work out at first, put it on the back burner, try something new, and then come back later.
Great. Thank you. That's an excellent overview. So now we understand a general idea of what we can and can't eat, how we're going to eliminate, and then we're going to reintroduce the foods back, and then we're going to really customize the program for maintenance. And ideally, this is how we're going to eat going forward in life in order to maintain the best possible health. So let me jump over to Risa for another question. As thyroid patients, we're used to being targeted, every week. Woman's World and every magazine in town has the new thyroid cure, and, drink lots of celery juice and you're going to cure your thyroid. And there's always something, or lose 30 pounds in one weekend, weight loss program and stuff. So, forgive us if we're a little dubious sometimes. And we want to know that there's more than just marketing claims behind any recommendation. So can you tell us about some of the science, and is there evidence that the AIP diet actually works out there, or is this just something that people are recommending? And I think we know the answer, that is that there is some science, but tell us a little bit more about the information that supports this as a genuine part of a good autoimmune thyroid treatment program.
Yes. So there are studies that have started to be released and to be conducted AIP is fairly new. So the science is new. And so as far as the data is concerned, there isn't a ton of data, but the new studies that have been released are definitely showing improvement. And we're seeing improvement with quality of life. We're seeing improvement even with inflammation markers. The CRP, the C-reactive protein, is a marker. And we are seeing some movement with antibodies. There's not a ton, but there is definitely evidence. In my office, I work with a lot of autoimmune, me being one of them, but I have been able to work with people to reverse Hashimoto's. We have done it in my office. So as far as that clinical study, I've worked with thousands of people and over the years, and we have absolutely seen a change. I recommend a Fab5 supplement protocol because, again, I know that we're in the state of inflammation. I am helping to increase gut health while I'm putting out that inflammation and healing those tight junctions and reestablishing the integrity of the intestinal lining is critically important. But a third of it is also genetics. And then there are some other components. There's toxicity levels, mercury and Epstein-Barr virus. There's MTHFR, a lack of vitamin D, some pathogens. There's a pathogen, a parasite called Blastocystis hominis that is a root cause to Hashimoto's. So I dive deep. I do a stool test and a blood test for everybody I work with to find out what these root causes could be. So yes, there are some studies that are starting to come out and the results are all positives. There, you will find science in there that tells you there is no evidence that it will work. So be careful when you Google. But the autoimmune community absolutely does have science behind it saying that they've taken these clinical trials of people and they are showing improvement. But we don't have as many studies as we need. But there are there, and I see it in my own office. I see it with myself and people that I work with.
Great, thank you. I'm going to jump over to Stephanie with a question about, we know that to benefit from AIP, we need to follow these rules, these elimination and reintroduction rules about the different foods. But you mentioned earlier, and Risa did as well, AIP is not just about what we eat or don't eat. It's also really important to incorporate a variety of lifestyle components into the picture, as it is really, with any illness, right, or any chronic disease. It's not just taking a medicine or a certain food. It's always got to be more holistic approach. You've got to take a look at all of the different factors. Can you tell us about the most important lifestyle components that are really essential parts of the autoimmune protocol and the AIP lifestyle?
Yes, absolutely. I think that this is a really great question. And I think it's something that is so often overlooked when we start AIP that we just focus on, oh, I can't eat this. What do I do? And we forget about the lifestyle element to it. And it's really, really important to kind of achieving better autoimmune health. So what are the three main things we want to look at? We want to look at sleep, stress, and movement. And all three of these really play such an important role in actually modulating the immune system, even supporting your gut health and also your hormone regulation, which is all really critical for Hashimoto's. So first, looking at sleep, we know sleep is really important, and we know it's, really critical for brain health, immune health, hormones, and metabolic health. And sleep is really important. Why? Because it's the time when our body is repairing itself. And, with autoimmune disease, we really want to have enough repair time and restorative time for our bodies to, regenerate and kind of repair tissue. And so, we want to really look at getting, about 7 to 9 hours of sleep. Of course, this varies per person, but that's kind of a general idea. What are some ways to kind of improve sleep? You want to really start looking at your sleep environment and kind of what's called sleep hygiene. So what are some ways you can do that? You can start, kind of winding down at night, dimming down your lights, making sure your bedroom is at a cooler temperature, which will actually help you sleep better. And then of course, the hardest part is like limiting screen time for people. And I know that's the hardest part for me too. But it's something that can really help kind of get our circadian rhythm back in order. Next would be looking at stress. Now, stress, I would say for most people, is actually definitely the hardest thing to control, right? Because there are a lot of things we can't control in our lives, but stress management and kind of working on stress resiliency is actually really important for autoimmune disease, because unfortunately, you know, in today's world, we live in so much chronic stress, and that chronic stress is basically putting us in this chronic state of fight or flight, right? And so it's increasing our inflammation, our cortisol levels, and unfortunately, that is also leading to things like leaky gut and autoimmune issues. So we really want to be able to kind of build up our stress resilience so we can kind of handle the chronic stress, because we can't control everything that comes our way, right? And so what are some ways we can do that? And that would be through looking at kind of mind-body techniques, such as deep breathing, yoga, meditation, like even things like just finding community and social connection can also really help kind of modulate kind of your stress response. So it really looks kind of differently for each person. I think you kind of have to figure out what works for you, because not everyone's going to love everything, and just kind of experiment a little bit to see what helps your kind of stress resiliency. The last one would be movement. And again, I think this is something that can be also challenging with people, you know, when you have autoimmune disease, your energy levels can be low, but movement, appropriate movement, I should say, is really important. But it's about finding that balance. And I like to say movement instead of exercise, because I think when we think exercise, we think, oh, I have to go to the gym, I have to do these crazy workouts. But really with autoimmune disease, you want to find that balance between like a sedentary lifestyle and something that's kind of like overexertion, right? Because if you're sedentary, that can lead to more compromised immune system and kind of a decreased resiliency to stress. But whereas if you're over strenuously exercising, that can actually lead to things like leaky gut. So you want to find that balance, and each person's going to be a little different, but you know, it can just be really simple things like taking a walk around the block. It can be gardening, dancing, you know, even cleaning the house. Like so many things can really count as movement, which can really help kind of your stress response. So another thing I like to remind people is that if you feel like the dietary aspects of AIP are too challenging or too overwhelming for you, you might even want to start with the lifestyle aspects. And you can just, you know, start reevaluating your sleep, maybe getting a little bit more movement in, and kind of trying some like deep breathing techniques, you know, just to kind of get yourself started. Because I know the diet, you know, for some people, you know, some people want to jump in right away to the diet, and some people are like, it's, you know, it scares me. So, you know, you can kind of like figure out for yourself which makes the most sense for you. And again, remember, AIP is the template. It's really your call on how you want to handle it.
Terrific. Thank you. We have one more prepared question, and then we're going to jump into some of your questions that we've been keeping track of. So I'm going to go over to Risa. And Risa, this is the question that I think as a thyroid coach, I hear often from people, which is if someone is overweight, will they lose weight on the AIP diet? Because there's, you know, sometimes we want to follow an AIP diet for the inflammatory benefit and the symptom benefit and the health benefit. But in many cases, if somebody's also struggling with some extra weight from their Hashimoto's and their hypothyroidism, they want to lose weight. And are these at odds with each other, or are you going to lose weight, or do you have to really change gears in order to get weight loss? So how does that work, Risa?
So I always say weight loss is a side effect of wellness, and the AIP protocol focuses on wellness. So the odds of you losing weight are extremely high. The only thing that would really prevent you from losing weight is, there's the 5 reasons why we don't lose weight, right? It's toxic overload, thyroid dysregulation. So if your TSH or if your free T3 is very low, it's going to be difficult for you to lose weight. If we have some cortisol affecting our T3, reverse T3, or our uptake, it's going to be difficult, but you probably still will lose weight. Blood sugar dysregulation, hormone imbalance, cortisol dysregulation. Those are all reasons why and sex hormone imbalance, did I say that? So those are the 5 reasons why we don't lose weight. So if you should lose weight on the AIP, typically, depending on how you ate before, if you ate a really junky diet, I would imagine for sure you're going to lose weight. If you ate pretty clean before, you would probably lose weight because, again, we're quelling the inflammation. I always say we've got a huge fire in the basement, and we've got somebody on the 2nd floor saying, hey, can you help me change the light bulb? So we can't quite get to the light bulb. We'd be happy to help you change the light bulb, but we got to put this raging fire out. So the AIP, the protocol helps you put the fire out. So once you put the fire out, then you know your body wants to hold on to all the resources when it's in danger. And so if we have a constant cytokine storm, we have a major inflammatory system going, Th17's activated, and we're in a state of inflammation, the body's going to hold on to every resource it has. Once we put that fire out, then it doesn't have any issue giving out what it doesn't need anymore. So the answer to the question is most likely everybody loses weight on the AIP protocol. But if you don't lose a lot, or, you know, there's a couple of caveats that would prevent you from losing a significant amount of weight. So I would say follow the road down those other pathways to see if that is you. And, you know, of course, our thyroid, as we all know, is our metabolism gauge, right? So we want to make sure our free T3 is good and we're in balance.
Great. Thank you. I'm going to stay with you, Risa, because we're moving into questions now from our viewers. And they've been sharing a lot of questions. So the first question is about whether or not the AIP diet can help eradicate H. pylori. And H. pylori, for those who may not be familiar with it, is a bacteria that, in many cases, is the contributing factor that creates ulcers. And we also know that other bacteria can be at the root of irritable bowel and some of the other issues that affect our gastrointestinal system. So beyond this whole inflammatory process and the other things, can the AIP diet actually help with H. pylori and even, in fact, maybe ulcers?
So technically, you know, in functional nutrition or functional medicine, we believe that the body is one whole interconnective unit and everything has to do with each other. But H. pylori, as you mentioned, is a bacteria that can cause peptic ulcers or gastric cancers, depending on if you have virulence factors and how present it is in the system, in the gut. But it really doesn't have that much to do with an AIP. The AIP, again, is going to take out the inflammation. So the consequence of having H. pylori, if it's really bad, you're going to have some inflammation, but it doesn't help to quell it, doesn't help to kill it. And it really won't affect it in a way. I mean, it's a pathogen. We've got to kill it. So we would need some natural agent or something to kill that pathogen. AIP, again, would be very helpful for the inflammation, but it really wouldn't affect the state of H. pylori.
Okay, thank you. Stephanie, I'm going to jump over to you. One of our viewers wants to know how you had mentioned that too much exercise may contribute to leaky gut. Can you explain a little bit more? They wanted to know how is that possible, or how does that work?
Yeah, so basically from my understanding is, you know, when we over exercise, so basically when our body's kind of in a state of stress, right? So actually over exercising can put us in a state of stress. And that means basically your body's prioritizing things that are not digestion. So it's actually diverting blood flow actually away from your digestive system. So if you're kind of overexerting yourself, you're putting yourself kind of in more of a chronic state of stress, which unfortunately then kind of does come back to your gut. And we know that stress can actually lead to things like leaky gut and make things worse. Hopefully that kind of answers that question. Great.
Thank you. I'm going to stay with you for the next question that one of our viewers has for you. Says, I'm nervous after the elimination phase to start the reintroduction because I feel so good without all the trigger foods. And I'm really nervous to introduce these foods back in. And what am I going to do if my symptoms are coming back? So this viewer wanted to know if you could have some advice for that fear, basically, of going into the reintroduction phase.
I think this is a really wonderful question because I think so many of us experience this fear. You know, when you eliminate foods and you're feeling wonderful, you're like, why do I want to go start eating these foods again if I feel great? So something I like to do is I like to remind myself and other people who are going through the same thing that, you know, what we want to do is we do want to have as much diversity as we can because that will ultimately support our health the most. And so kind of keeping that in the back of your head, like I'm doing this for my long-term health. I might feel really good right now, but in the long run, I know I need to have more diversity to basically feed my gut microbiome, which in turn will support my immune health. And I kind of like to frame it as like, this is for me long-term. And also you want to make sure you want to remind yourself, you want this to be a sustainable thing for you, right? So if you're so restricted, for the rest of your life, it's going to be hard sometimes to like go out, to restaurants and be with family and friends and like kind of the social aspects. So I like to also remind myself, right, there's also kind of the sustainable lifestyle aspect of it. And you want to make sure that, I like to think of AIP, it's not like a diet, it's really a lifestyle. And so I 100% understand the fear. And, I do recommend when people start doing the reintroductions, like make sure you pick a day where you're feeling really good and you feel like you're relaxed and, and maybe even have like a friend or a family member there with you. Sometimes it's nice to have actually a little support with you, and just take it slow and remind yourself, okay, if it doesn't work out, it's okay. It's okay. I always like to remind myself, okay, you got to the point of feeling really good. So say you do have a flare from a food, remind yourself, okay, I can get back to that stage again where I was feeling good, right? You felt it before and you can get back to that point. So don't feel like, too much despair, and just try to keep, a little positivity. It's hard and I understand the fear, but just keep it calm, relaxed, and hopefully it works out.
Great advice. Thank you. Risa, one of our viewers said that she's heard about other styles of elimination diets, and she wants to know if you can talk about what's the priority of the AIP in that hierarchy, and what other types of elimination diets are out there for us at least to be aware of, if not to consider as possible approaches we might at least look into, if not follow.
Yeah, that's a great question. So there's tons of different elimination diets that we do. And in my book, Food Frame, and what my methodology is I basically look at your health status. I believe that we should be eating for your health status. So we detox for 2 weeks and then we collect the information. And then I highlight 6 different diet types, but AIP is one that I would recommend for people who have autoimmune. Now, once you get off of that, you go into more of a paleo, more broader paleo, or you can go into a low lectin diet. So that's a little bit different, but there's a lot of overlap, but a low lectin diet would be great. And that's still eliminating some things. So there's other elimination diets that you can do for sure. We talked about intermittent fasting a little bit. That would be great for blood sugar dysregulation. It also gives the digestive tract a little bit of a break. So you could do that. We know that gluten helps to push those tight junctions apart. We only have that one layer of epithelial cells, as Stephanie was saying, in the intestinal lining, so it's very fragile. And once you pull those apart, gluten, we know, is one of those foods that will increase, will further your tight junction. So you could do your own elimination diet and just say, I'm going to get off gluten for 3 weeks. Just take gluten out of your diet. That's it. Don't change anything else. See what happens. If that's good, then jump on the bandwagon for dairy and say, I'm going to take gluten and dairy out and for 3 weeks each, or together, or piggyback, and see how you feel. So you can create your own elimination diet that way. Those are, there's a low FODMAP diet that is basically an elimination diet as well. It's not really tailored for somebody with Hashimoto's, but a lot of people with thyroid issues have a lot of SIBO, small intestinal bacterial overgrowth, or perhaps have some IBS, irritable bowel syndrome. So low FODMAP might be good. I do get people coming in my office with both, so you kind of have to pick which one, but I'm always going to pick AIP first because it really quells the inflammation and it's going to help kill off that bacteria in the small intestines as well. But I sort of do a blend in my office of a customized AIP low FODMAP kind of elimination process. And then, as Stephanie mentioned, whatever, some people on low FODMAP can handle a quarter of an avocado, but a half of them just crushes them. So go according to what works best for you. And if a quarter is good, then stay there for a while. And then if you add to a half, then dial it back. And you just got to keep checking. Everybody is different. Every body is different.
Mm-hmm. Thank you. Stephanie, question for you. When we are doing elimination phase, so the first part of the diet, are we eliminating all the things at once? Or are, because we know with reintroduction, we're going to kind of try things and go a little bit slowly, but do we just take our master list of do not eat this on the AIP diet and stop all at the same time? Or do we do one at a time then? Just like when we're reintroducing, we're going to reintroduce more slowly. How does that part work?
Yeah, this is a great question. I'm happy we can cover it now. So basically, there are kind of like two different approaches you could take with AIP. One, which is called the slow and steady approach, which I personally think is very successful for most people. And I think most people actually thrive a little bit better with doing that approach, which is where you really just take your time a little bit. And maybe you start with like the ones that we know are the most kind of inflammatory, especially for Hashimoto's, like gluten and dairy. Maybe you do that for 2 weeks and then you build up and add soy and sugar. And then, you just keep adding it kind of at a pace that works for you until you get to that full elimination phase. And then once you're at that full elimination phase with all the foods gone, then you would do that for 1 to 3 months, depending on kind of where you're at. But some people, prefer going cold turkey, and they like to be like, okay, I'm just going to eliminate everything at once. And I think it really has to do kind of your personality, what you think is going to work for you, and also your lifestyle. Like, do you cook a lot for your kids? Are you really busy at work? You have to kind of take those things into consideration, because it is a bit of a time commitment, and it does take time to kind of get into the elimination phase, and you have to kind of build that into your schedule. So it's really kind of very personal, and but both ways are perfectly great to follow, and either way works.
Well, and that leads me to my last question, and this is one where I'd really like to hear from both of you on this, but I'll start with you, Stephanie. When we are talking about the AIP approach, there's people who say, you have to be extremely adherent to every specific element of it, and you got to follow it to the letter of the law. And some people then become so intimidated and overwhelmed, they basically give up. At Paloma, we have our AIP diet app, which helps people, supporting them through the process with their smartphone and giving them good information and guidelines and things to support them. But some people say, I still get where I don't really know if I can't do every single thing, should I even do it at all? So is there a benefit to even a modified or sort of AIP light kind of approach to this, or do we have to follow everything to the letter, or it's not worth anything at all?
I mean, I think absolutely. I think, it's really, you don't have to follow it to a T, right? Like, everyone's different. Everybody is different, right? And so I would say, it's perfectly fine to customize AIP, and it can have great benefits still, right? Like, if you're focusing on those lifestyle elements, or you're just like, the only foods I can handle eliminating at the moment are gluten and dairy, and see how you feel. You might feel fantastic, and maybe that's all you have to do, right? Like, it's really, and I think, when we get so stressed about, I need to eliminate all these foods, that's actually causing more harm than good, I think. And I think, if you feel like this is just too overwhelming for me, that's fine. You don't need to go the whole way. You can just figure out what can you handle where you are in your life at that moment, and just stick with it and see how you feel. If you feel like you're not making progress, then maybe you start investing a little bit more, and you think, maybe I'll just try the paleo first and then move to AIP, because like a lot of people have see wonderful benefits on the paleo. So I think just experimenting and realizing you can still have great benefit without going the full way.
Risa, what's your philosophy on this with your clients and folks working with you? Is it all or nothing, or somewhere in the middle?
Yeah, I completely agree with Stephanie, because there are so many different types of people. I get people in my office all the time that say, okay, tell me what to do and I'll do it. Or I cannot do this. We got to chop this off into little pieces. So it can be very overwhelming for people. This is a huge change for some people, and they won't be compliant, and then they'll end up, going reverse, and they'll do more damage than anything. So absolutely take it into whatever pieces are right for you. I like it. I always say, if somebody's punching you in the face and they're punching you 10 times in the face, and then they stop and they punch you 2 times, it's definitely better, right? And you might be okay with 2 times. So it might, as Stephanie said, you might respond fine with just taking out gluten and dairy and soy. and sugar. So you might not have to take out the legumes, but every body is different. So do what works best for you, and do, when you're doing something, give it your all. So whether your all is 80% of the protocol, then do that. If it's 100%, great, but do what works best for you.
Wonderful. Well, I think on that note, what I'm taking away here is one size does not fit all. Your mileage may vary, but the basic premises that are part of the autoimmune protocol are all common sense things that not only are going to help support our autoimmunity and, better balance in the immune system, but frankly, most of the things that are being done are good for overall health as well, and those healthy lifestyle factors as well. So I am going to turn it over to Katie, but before I do, I'm just going to say thank you very much to both of our guests, Stephanie Ulrich and Risa Groux. And we are going to shift over to Katie, but thank you very much. And this has been really educational for me, and I know our viewers are saying they appreciated it and loved it as well. So obviously you folks really were able to provide some wonderful information that people were looking for. So thank you.
Thank you.
Back to Katie.
Thank you, everyone.
In the studio.
My guest bedroom. Mary, you nailed their last names. Well done. Thank you, Risa and Stephanie, both for your time and information. And thank you to all of you who have joined us live tonight and asked great questions. We will be sure to send out the replay of this email. It'll be available on our website also, so you'll know where to find Risa and Stephanie and all of their resources. They also have offered very generous discounts to viewers of this event, so we will send those out in the email as well. And one last plug, Paloma Health has a free mobile app that has a lot of information in it and a lot of resources. You can buy your at-home thyroid test kit, you can schedule your consultations with your thyroid doctor, you can track your labs, all of this. On top of that, we have a 12-week program that takes you through the AIP diet. It's kind of like having a health coach in your pocket. Our hope is to give you education and guidance through this. And like both of our speakers have said, it's a framework. It's designed to give you more education about why you're excluding foods, how to reintroduce them, how to set up your kitchen for success, how to sleep better, etc. A lot of information in there. I won't list all of the things. You can also keep an eye out for soon. There will be a section in our app for thyroid healthy workouts, thyroid healthy yoga, breathing exercises, and meditations, all designed to help you reduce stress, which, like we've mentioned, is a very important part of the AIP diet. So again, we will make sure you know where to access all of this information. And thank you to everyone who's joined us. We'll see you soon.